Hi, this is Gene Ransom. I'm the CEO of MedCai, the Maryland State Medical Society, and I'm here with Olivia Simon, who's MedCai's EQIP Specialist. And we are doing another in our series of EQIP educational videos slash meetings. And today we're going to be talking about the Program Year 5 Cardiology Vascular bundles. So, EQIP, the Episode Quality Improvement Program, is an incredible opportunity for physicians to be involved in an advanced payment model. It is something that was created with CRISP, the HSCRC, and MedCai working in partnership together. Um, and we're very excited in our role and involvement in it to do education and outreach. And the two or three biggest takeaways that I'd like to make sure that everybody on this call gets is number one, it doesn't cost a thing to do an opportunity analysis, and we can do that. Number two, you can do this program and be involved in a lot of other programs, MDPCP, you could be in an ACO, so that's a big positive as well. And three, there are multiple reasons why it makes sense to be looking at and considering EQIP. So without further ado, I'm going to turn the meeting over to Olivia to have her give a high-level overview of EQIP and the new bundles that we've added in the cardiology slash vascular space for 2025. Feel free, if anyone has any questions, just to go ahead and raise your hand, and we're happy to answer them as we go along. Olivia, it's all yours.
Thanks, Jean. Hi, everyone. Thank you so much for joining us today. So as Jean mentioned, MedCai has been hosting a series of EQIP specialty webinars to just give an overview of EQIP and also talk about the opportunity for several specialties in 2026. So this is our fifth and final planned webinar focusing on the cardiology and vascular episodes. If anyone has any questions, please feel free to raise your hand, type in the chat. You can also find my contact information on this slide. So thanks again for joining. So before we get into the program details, I wanted to just take a moment to mention a little bit about the history of EQIP. So as a result of the total cost of care model, Maryland practitioners were left out of national Medicare value-based payment programs. And so back in 2022, the HSCRC, the Health Services Cost Review Commission, created this voluntary episode quality improvement program to give Maryland practitioners the opportunity to participate in value-based payment. EQIP is specifically, again, for Maryland practitioners in Medicare. And this program going into 2026 will be the fifth performance year that this program has been operating. So what is Maryland's Episode Quality Improvement Program? As I mentioned, this is a completely voluntary program. It's an advanced alternative payment model, and it's for Maryland generalist, specialist, or other CMS-approved practitioners. So by participating, practitioners who treat Maryland Medicare beneficiaries are engaged in care transformation and value-based payment, and this is through an episode-based approach. So essentially, by participating in this program, participants will be held accountable for achieving both cost and quality targets within one or more clinical episode categories. So before we get into too much of the program details, I want to, again, just emphasize EQIP as an advanced alternative payment model. So CMS's quality payment program has two different tracks. The first is the merit-based incentive payment system, or MIPS, and then the other is advanced alternative payment models, or AAPMs. EQIP falls under this advanced alternative payment model track, and therefore practitioners that participate in EQIP are on the AAPM track of the quality payment program, and they are considered qualifying APM participants, or QPs. QPs are exempt from MIPS reporting and MIPS payment adjustments, and also they will currently receive a higher Medicare physician fee schedule update than non-QPs. So at this time, this updated physician fee schedule is set at a 0.75% qualifying APM conversion factor. I do just want to note that The APM incentives are set by Congress, so they can be subject to change. But again, as of now, this conversion factor is set at 0.75%. So what this means is by just enrolling in EQIP, by participating in the program, practitioners will again be exempt from MIPS, and then they will also receive this physician fee schedule update. This is just for your participation. This does not look at your performance within the program. It's just strictly based on your involvement and engagement in the program. So now let's get into the actual EQIP program. So I've broken the program up into three main elements. So starting with enrollment. So the annual enrollment opportunity is in July through August of each year. So tomorrow is actually the official start of enrollment for Performance Year 5, calendar year 2026. During this enrollment period each year, practitioners can decide that they would like to participate in EQIP. And they do this by enrolling in an EQIP entity. An EQIP entity is just one or more practitioners that are going to participate in the program together. During the enrollment period, in addition to creating an entity or joining an entity, the entity will select the clinical episodes that they would like to participate in during the performance year. And we'll talk a little bit more about those episodes in the upcoming slides. Then the second element of the program is this target price is set for the entity. So the cool thing about EQIP is a unique average cost or target price is set for each individual EQIP entity for each episode it enrolls in. So the way it works is EQIP goes back to its baseline period and it looks at the average episode costs for the practitioners within that EQIP entity. And again, that average cost in the baseline period becomes this target price or goal price that the entity is trying to be below in order to generate savings within the program. The final element of the program is the performance assessment. So the really other cool thing about EQIP is it uses claims data to assess all performance, both cost and quality. And so at the end of the year, the performance year total episode cost will be compared to that target price that was set, and the savings will be aggregated. And then at that time, any incentive payment would be due to the EQIP entity, which again, we will talk about this a little bit further on the upcoming slides. So again, step number one is enrolling within these episode categories. So there's a few different volume requirements for your entity to be able to select a specific episode. Jean had mentioned this earlier. We do offer an opportunity analysis where you can basically send in your individual MPIs to the EQIP inbox, and CRISP will run your baseline volume to determine which episodes you are eligible to select. I want to mention there are three main elements that each episode consists of. So the first is this trigger. The trigger are the specific codes that initiate the start of an episode. So these codes are indicating that a patient has a particular condition or underwent a particular procedure. Then we have this look back window. So once the trigger occurs, this is the time period prior to that trigger event when all of the relevant costs associated with that episode will be included. And then there is this close period window. This is the time period following or after the trigger when all of the relevant costs associated with the episode will be included. So for Performance Year 5, calendar year 2026, we do have 123 episodes that are available. Again, to determine which episodes you may be eligible to select, you can send in your MPIs to the EQIP inbox. They can run that opportunity analysis for you. But all of the episodes are organized into different clinical categories. So here on the screen, you can see the episodes have been organized into one of the following categories. Today, I'm going to briefly show you which episodes are available under this cardiology vascular category and show you an example of how one of those episodes would actually unfold. So here you can see on the screen, we have all of the PY5 Cardiology Vascular episodes. So I believe there were five. Yeah, so five, the first five episodes are currently offered in 2025. And then we added six new episodes that fall under this category for 2026. And I will share this slide deck with you all after the call so you can kind of look through this a little bit further at your own pace. But as I mentioned, we're going to just look at one as an example as to how the episode would actually play out. So the one that we're going to be looking at today is hypertension essential. This is a chronic condition. And so we are going to start by looking at those trigger codes that I had mentioned. And again, this is what is initiating the start of an episode. So here on the screen, you can see the specific ICD-10 codes that would initiate the start of this particular episode. So when these codes are included in claims data on a Medicare patient, that is what is initiating this episode. Then once that trigger code has been submitted via claims data, this episode length is established and it's used to determine how much the total cost for that episode is. So here in the middle, you can see the episode trigger. So again, that would be the day of the submission of the particular code. And then for hypertension essential, the look back window is 30 days prior to the episode trigger. So EQIP will go back 30 days from when that episode had been initiated and count all of the relevant costs included in that episode up to 30 days back. And then because this is a chronic condition, the close period window is actually until the end of the study period, which would be the end of 2026. So again, all of the relevant costs associated with this episode would be included until the end of the performance year. Each episode will have unique trigger codes and a unique episode length, look back window, and close period window. This is just, again, an example of one of them so you can get a better idea of how each episode is constructed. Now I want to touch on what's actually included within those episode costs. So the total relevant costs for a single episode include the Medicare Part A and B claim payments for the beneficiary for services that are rendered within that episode length and considered relevant to the episode. So you can see some examples of typical relevant costs and services that are included in the episodes on the screen here. Each episode will also have a workbook that you can look through with all of the relevant codes. So there's relevant diagnoses codes, prescriptions, and other associations that may be included. But here again are just some examples of what you could expect to be included within those episode costs. I do want to note that, again, these relevant costs are just considered clinically associated with the condition or treatment of the episode, and this is regardless of who is providing them. Also, the episode triggers and all of these relevant costs are derived directly from Medicare fee-for-service claims. So there's no additional reporting requirements for EQIP participants. All of this information is strictly claims driven. So CRISP will get this information directly from Medicare, and you don't have to do any additional tracking on the costs or the triggers. So next, again, is this target price. I already mentioned this earlier, but just to kind of review, each entity is going to get a unique target price or goal price per episode it selects. And this is, again, that average total relevant episode cost for the episodes that are attributed to the practitioners within that baseline period. EQIP's baseline period right now is 2019. I do just want to mention that the emergency department episodes will use 2023 for their baseline period in performance year 5, but all other episodes will still use 2019. At the beginning of the performance year, these preliminary target price will be available to the entity, and then the final target price will be made available at the end of the program year after it has been adjusted for like inflation. And so again, during the performance assessment period, these total episode costs will then be compared to this target price that has been set for the group to determine if the entity has generated savings or not within their episode categories. So that is all things episodes, episode costs. The next element of EQIP does look at some quality metrics. So EQIP has 3 quality metrics. They are advanced care planning, medication reconciliation, and BMI. And so the way it works is that each episode that the EQIP entity is attributed to, the HSCRC will assess whether these 3 measures were performed at least once by any practitioner within the year preceding the end of that episode's period. There's a few things to note here. One, this is also measured strictly through claims data. So on the upcoming slides, I will have a little bit more information about the quality metrics, including their submission codes that would need to be included on the claims in order to satisfy EQIP's quality metric requirement. These measures also only need to be billed once, and this can be by any practitioner to receive credit. So for example, if you had an EQIP entity and one of your practitioners triggered an episode and they were attributed that episode under EQIP, and that Medicare patient went and saw another practitioner who was not even in EQIP, not at your practice, but that outside practitioner actually saw that patient within the year preceding the end of the episode and completed advanced care planning and included the appropriate submission code, that would actually count towards your credit under EQIP. So on the next few slides, again, I have a little overview of each of the metrics. I'm not going to go through all of this information. I will share this with you so you can look through it at your own time. But the biggest thing I want to point out here again are those submission codes. EQIP quality metrics will only be satisfied by the submission of the following codes. For advanced care planning, there are 2 codes that could potentially satisfy this requirement. For medication reconciliation, again, here you can see the submission codes. There are 3 potential codes that all would satisfy this requirement. And then lastly, for BMI, there are 5 potential codes that could satisfy. So I encourage you to kind of review this at your own pace and look over the submission codes. And if you have any questions regarding billing for the quality metrics, you can reach out to either myself or the EQIP inbox, whose contact information will be on the last slide. So now we've reviewed both the costs and the quality related to EQIP. And we're going to kind of talk about how an incentive payment is actually determined. So I've broken this incentive payment methodology up into 5 main steps. So we're going to start over here on the left in step number 1, and that is to analyze the performance period results. So at the end of the performance year, the total performance year episode cost will be compared to that target price. And if the costs are less than the target price across all episodes in which the entity is participating in, then savings are achieved. That's step number 1. You get a check and you get to keep moving on through this methodology. So the second bullet under this is you also need to ensure that at least 3% of savings are achieved. This is just to ensure that your savings are considered statistically significant. So that's step 1 too. And then also, if there are any dis savings from a prior year, they would also need to be offset before you can move forward in this methodology. I will touch on the dis savings policy on the next slide. If you are a new participant, this would not apply to you, but EQIP does require you to offset any prior year dis savings, again, before you can move forward. So that is number 1, determine your savings by analyzing your performance period results. Then we go into the second box, which looks at shared savings. So EQIP is a shared savings program, which means some of your savings will be retained by the entity and some will be retained by Medicare. So each care partner's target price is ranked on the state level and compared based on relative efficiency. And so then the entity is put into one of three tiers. You can see here that the lower cost practitioners will be in this higher tier, getting 80% of their savings, and Medicare would retain 20%. On the other end of things, higher cost practitioners are in this lower tier, only getting 50% of their savings, 50% being retained by Medicare. So that's number two, determine that shared savings split. Then we move into quality. So this is the clinical quality score component. At this time, 5% of the incentive payment will be withheld pending quality assessment. So essentially what will happen is EQIP will look at the performance rates of each one of the three quality metrics for the entity. And based on how well the entity was able to perform those three metrics, they will get to keep up to that full 5% back. If they fall somewhere in the middle, maybe they'll only get to keep 3% and they'll end up losing 2% of their incentive payment. But this is where quality comes into play. Then there is this incentive payment cap. So the incentive payment cap is 25% of the average care partner physician fee schedule expenditures for the preceding calendar year. Just this step just checks to ensure that the incentive payment does not exceed this cap. And then lastly, this amount that we have here at step 5 is paid in full directly to the payment remission source that's indicated by the entity during the enrollment period. And this is paid approximately 9 to 12 months after the end of the performance year. I do want to note that the entity then can distribute the payments to care partners however it desires. So last thing I want to touch on today is inadequate performance. So I do think it's important to note that the risk in EQIP is taken at the state level, meaning EQIP entities are not expected to repay CMS as a result of inadequate performance. However, the HSCRC has created the following policies to ensure that EQIP drives meaningful improvements in cost efficiency and quality. So I mentioned part of the first policy, EQIP's savings policy, during the incentive payment methodology. But this savings policy consists of two different parts. The first is this annual accountability, and this is what I had mentioned. So prior to earning an incentive payment, the entity would be required to offset any cumulative savings from the prior performance years. And then the second element of this savings policy is this removal accountability. If an EQIP entity generates savings in 2 consecutive program years, and it's in the lower 2 terciles of that tiered shared savings rate, the entity would be removed from EQIP for 1 year, at least 1 year, before being able to re-enroll in the program. There's also this catastrophic quality performance policy. If the entity is below the 20th percentile benchmark threshold for a single quality measure for 2 consecutive years, they would also be removed from the program, have to sit out for at least a year before being able to re-enroll. So most importantly, I want to end on today again by just mentioning that enrollment for Performance Year 5, calendar year 2026, will officially open tomorrow, July 1st. And it will be open until Friday, August 29th. So there's about 2 months for you to learn more about EQIP and decide if you want to enroll. Please reach out to the EQIP inbox. The email is listed here on the screen, or myself if you have any questions. Or again, if you want to run your individual practitioner MPIs to determine your opportunity analysis, which episodes you may be eligible for, we are certainly happy to do that for you. And yeah, that kind of concludes the presentation today. Does anyone have any questions? I think I see anything in the chat.
I think the biggest takeaway for everybody is that if you can send your NPIs in, we can tell you which bundles you qualify for, and then you can make a better decision. There's no cost or obligation to do that. You can either email it into the CRISP inbox, you can email it to Olivia directly, and she can help process it with CRISP. But that is something that I would put down as your next step. from a cardiology point of view.
Yep. Thanks, Jean. I don't think we have any questions. Last chance.
All right. Well, thank you
All
everybody
right.
for participating today. We'll have the video up later on today for anybody who wants to share it or anybody who wants to look at it again.
Yep. Thanks, everyone.